Florence Nightingale, a name synonymous with modern nursing, continues to inspire healthcare professionals worldwide. Her legacy extends far beyond her iconic image as the Lady with the Lamp during the Crimean War. Nightingale was a visionary leader, a meticulous statistician, and a passionate advocate for healthcare reform. Her tireless efforts transformed the profession of nursing, elevating it to a respected and essential component of healthcare systems globally. Born into a wealthy Victorian family, Nightingale defied societal expectations by pursuing a calling to serve others. She recognized the dire state of hospitals and the urgent need for improved sanitation and patient care. Driven by a deep sense of compassion and a sharp intellect, Nightingale challenged the status quo and dedicated her life to revolutionizing healthcare practices. Her unwavering commitment to her patients, coupled with her innovative approaches to hygiene and hospital administration, laid the foundation for modern nursing as we know it. Nightingale's impact on healthcare extends far beyond her own lifetime. Her writings, teachings, and tireless advocacy continue to shape the nursing profession today. Her emphasis on continuous learning, data-driven decision-making, and patient-centered care remain cornerstones of quality healthcare delivery. By examining Nightingale's life and work, we gain valuable insights into the evolution of healthcare and the enduring power of compassion, dedication, and a relentless pursuit of excellence in patient care. Her story is not just a historical account, it is a timeless reminder of the transformative power of one individual's commitment to making a difference in the lives of others. Nightingale's legacy serves as a beacon, illuminating the path for generations of healthcare professionals to follow in her footsteps and strive for excellence in patient care. Florence Nightingale's journey into nursing was unconventional, even rebellious for a woman of her time. Born in 1820 to affluent British parents, Nightingale was expected to embrace a life of societal engagements and domesticity. However, she felt a strong calling to pursue a higher purpose, a desire to alleviate suffering and make a tangible difference in the world. Despite strong opposition from her family, Nightingale was drawn to the plight of the sick and impoverished. She sought out opportunities to visit hospitals and workhouses, witnessing firsthand the deplorable conditions and lack of basic care. These experiences solidified her resolve to pursue a career in nursing, a profession considered by many at the time to be disreputable and lacking in intellectual rigor. Undeterred by societal expectations and familial pressures, Nightingale embarked on a path of self-education. She devoured books on medicine, sanitation, and hospital administration. Her thirst for knowledge extended beyond traditional textbooks. She sought out practical experience by volunteering at hospitals and studying nursing practices across Europe. Nightingale's determination and unwavering commitment to her calling eventually swayed her family's opposition. In 1851, at the age of 31, she enrolled as a nursing student at the Institute of Protestant Deaconesses in Kaiserswerth, Germany. This pivotal decision marked the beginning of her formal journey into nursing, a journey that would forever alter the course of healthcare history. The Crimean War of 1853 to 1856 proved to be a defining chapter in Florence Nightingale's life, propelling her into the international spotlight and solidifying her reputation as a pioneer in nursing. News of the appalling conditions in British military hospitals in Turkey reached England, painting a grim picture of neglect, disease, and soaring mortality rates among wounded soldiers. In response to the crisis, Nightingale was commissioned by the Secretary of War, Sidney Herbert, to lead a team of nurses to the Scutari Barracks Hospital. Upon arriving at the overcrowded and unsanitary facility, Nightingale and her nurses were met with a scene of unimaginable suffering. The hospital, ill-equipped and lacking basic supplies, was ravaged by typhus, cholera, and dysentery. Undeterred by the overwhelming challenges, Nightingale immediately set to work implementing drastic reforms. She established strict hygiene protocols, improved ventilation, and organized the chaotic wards. Recognizing the importance of nutrition, she fought for better food supplies and ensured that soldiers received nourishing meals. Nightingale's tireless efforts, coupled with her unwavering compassion for the wounded, earned her the endearing nickname, the Lady with the Lamp. She would often work late into the night, making rounds with her lamp, offering comfort and tending to the needs of her patients. Her presence brought solace and hope to the wounded soldiers, and her unwavering dedication inspired her fellow nurses and doctors. Florence Nightingale's impact on healthcare extended far beyond her compassionate care for wounded soldiers. She possessed a keen intellect and a deep understanding of the connection between sanitation and health outcomes. Her meticulous record-keeping and data analysis revealed the shockingly high mortality rates in military hospitals, which were largely attributed to preventable diseases. Armed with this data, Nightingale became a fierce advocate for improved hygiene practices in hospitals. She implemented rigorous cleaning regimens, ensured access to clean water and sanitation facilities, and introduced proper ventilation systems to reduce the spread of airborne diseases. These measures, considered radical at the time, directly challenged the prevailing medical beliefs and practices. Nightingale's data-driven approach to healthcare reform yielded remarkable results. The mortality rate at the Scutari Barracks Hospital plummeted from over 40% to just 2% within 6 months of her arrival. This dramatic improvement provided undeniable evidence of the effectiveness of her methods and silenced her critics. Her success in the Crimean War established Nightingale as a leading voice in healthcare reform. She returned to England a national heroine. Her reputation as a skilled nurse and a visionary leader solidified. However, she was far from finished with her mission to improve healthcare. Nightingale was determined to use her newfound influence to advocate for lasting change in both military and civilian hospitals. Upon her return from the Crimea, Florence Nightingale was hailed as a national hero. However, she shunned public acclaim and instead channeled her energy and influence into advocating for lasting healthcare reforms. She recognized that the deplorable conditions she witnessed in military hospitals were mirrored in civilian institutions across England. Nightingale understood that effecting change required more than just passionate pleas. It demanded concrete evidence and strategic planning. She meticulously compiled her observations and data from the Crimean War, publishing influential reports that exposed the dire state of hospitals and called for urgent reforms. Her writings, grounded in statistical analysis and first-hand accounts, provided a compelling case for change. Nightingale's advocacy extended beyond mere criticism. She offered practical solutions. She outlined detailed recommendations for improving hospital design, emphasizing the importance of light, ventilation, and spacious wards to prevent the spread of infection. She stressed the need for trained nurses and established rigorous standards for nursing education. Her efforts were instrumental in the establishment of the Nightingale Training School at St. Thomas' Hospital in London in 1860. This institution, founded on Nightingale's principles of rigorous training and compassionate care, became a model for nursing schools worldwide. It marked a significant step forward in professionalizing nursing and elevating its status within the medical community.